Currently, the United States is experiencing an epidemic of prescription drug abuse and misuse. Drug abuse can be described as the misuse of prescription medications to experience the euphoric effects. This epidemic not only affects the general population but also includes athletes that athletic trainers work with every day. Participation in athletics significantly increases non-medical use of prescription drugs, for instance, opioids and benzodiazepines, which are often abused for reasons such as pain due to injury, insomnia, fatigue, and euphoria. For example, sleep is vital for athletic performance, and therefore these medications can aid in normalizing their sleep cycles. Furthermore, of those who had reported the non-medical use of prescription opiates, 17% reported a history of athletic injury, including bone and soft tissue. For example, male soccer athletes reported 2 times more likely to abuse opiates when compared to their non-injured counterparts. Therefore, the goal of this project would be to increase the awareness of the statistical values of drug and substance abuse within athletics. Furthermore, athletic trainers can begin to enforce the policies and procedures which ban non-medical use of these medications. Additionally, the goal would be to educate and prevent drug use, however, also intervene and provide support when needed. The rider can be used to research policies that have already been successfully implemented at different institutions. For example, policies from the NATA, the NCAA, the AMSSM, and the NJCAA. Examples of these resources include things like the Substance Abuse Prevention and Intervention Toolkit. For example, the NCAA bans substances such as narcotics, stimulants, and anabolic agents in hopes to discourage student athletes from participating in these behaviors, and ultimately allowing them to remain eligible to participate in their respective sports. Additionally, the rider can motivate the elephant by incorporating an emotional connection. For example, presenting statistics of drug use in athletics based off of sex, age, sport, substance, injury versus non-injury, and death rates. In agreement, the rider and the elephant can work together on the path to shrink the problem, which could look like associations banning the use of specific substances to discourage athletes from risky behaviors, while also providing educational resources, prevention techniques, and further treatment resources for support when needed. While education is essential for student athletes, it can also be beneficial for their overseeing healthcare providers. The path can include researching and using the FDA, OSHA, and the DEA's resources on controlled substances based on state and federal governing bodies. These resources suggest policies and procedures of medications which the rider can provide as direction to the elephant. Further, these resources suggest things like storage, inventory, transport, and disposal of medications. Additionally, verification of ownership, distribution, and documentation of medications, while the rider researches, the elephant implements. The path can sometimes be expected to be linear and without faults. However, when the current path does not succeed, the rider can develop a new plan and the elephant can seek out the desired results. Leadership looks like the rider and the elephant motivating one another to follow the path and to help others follow as well. Additionally, while following the path, the rider and the elephant may identify the obstacles they must overcome. Some obstacles can include barriers such as time, money, or other resources. Therefore, further strategies may become beneficial. The desired outcome for this paper would be to change the experience that athletic trainers have when providing care to those who abuse medications. Furthermore, to provide athletic trainers with the necessary knowledge of statistical values, as well as what heightens the risk of abuse in the athletic population. Currently, I do not know how to personally measure success within my current setting, being that there is no data to analyze. However, measures for success would hopefully look like a decrease of drug use within sports, as well as the increase of those seeking and accepting mental health aid. Drug use can significantly affect the athletic training profession. With policies and procedures created and implemented due to the rider and the elephant, they may not have the negative experience of athletes suffering from addiction. Additionally, in the case of this issue, athletic trainers will have the resources and support to provide to their athletic population.